Good evening and welcome to this webinar on essentials of a valid consent. Litigation against doctors has increased 400%. Consent, its validity and its quality is the subject of a large percentage of these cases. The aim of today's webinar is to understand the basis of consent and to see the requirements of an ethically and legally valid consent. Consent is a state of mind. It is a permission or an agreement. In healthcare, it is a permission or an agreement given voluntarily by a competent patient for any medical procedure. Most doctors rely on implied consent before any medical examination, investigation, and intervention. Today, because of commercialization, lack of trust on both sides, and deteriorating doctor-patient relationship, it is advisable to take an express consent before any intervention with risk, especially surgery and anesthesia. Justice Cardozo in 1914 brought consent into the limelight by his famous ruling, "Every person of adult years and sound mind has a right to determine what shall be done with his own body, and a surgeon who performs an operation without his patient's consent commits an assault for which he is liable in damages." The ethical foundation of consent comes from the patient's right of autonomy. So, our patients who are competent have the fundamental right to determine what is to happen to his or her body. This is also enshrined in our Constitution of India, Article 21, the right to life and liberty. When we seek consent, we respect this right of autonomy of our patients. But how can a patient exercise his right to autonomy or decision-making if he does not have enough information? Which brings us to our next ethical duty, that is the duty to provide information and create an understanding in the minds of our patients. The way we inform is also under scrutiny. Doctors tell their patients what is to be done. They do not discuss any options. By this attitude of doctor knows best and he will decide what is to happen to his patients, we assume the role of a parent, and the patient is only supposed to listen and obey. This is called medical paternalism, and medical paternalism is the antithesis of autonomy. This medical paternalism has been rejected by our patients and also by the Supreme Court in the case of Samira Kohli versus Dr. Prabhaman Chanda, where the Supreme Court has greatly criticized medical paternalism. So we need to change from a doctor-centric consent to a patient-centric consent. The patient-centric consent is a process, not an act of signing a form. There are 5 essentials of a legally appropriate consent in non-emergency situations. First, we must check for competency. We must give enough information and time to the patient to make an informed choice. The patient must be given opportunity to discuss his doubts and fears. Patient must voluntarily come to an agreement about the treatment plan. And the last is documentation and authentication of this consent process. Let us look at each of these essentials in slight detail. So first is that the patient must be competent. A competent patient is an adult of 18 years, not unconscious, not under the effect of alcohol and drugs. For all incompetent patients, a proxy consent is required. This is under the Indian Contract Act. But in the Indian Penal Code, the age of consent has been stated in Section 90 as age of 12. So till we get further clarification, what we can do is for patients below 12 years, we need a proxy consent. Between 12 and 18 years, it is advisable to take the patient's consent along with the parent's consent. We can give the patient age-appropriate information and take what is called as an assent. After the patient turns 18, he can consent for any intervention. Second, enough information must be given to the patient in the patient's language without any medical jargon. The proposed treatment or procedure, the information must involve each of these procedures about specific diseases and their treatments. Disclosure of risks is a very important aspect of patient consent. Patients must understand that medicine is an imperfect science, treatments have their limitations, and in spite of taking care and caution, complications can happen. Disclosure is the doctor's safety net. But there is a dilemma. How much of risk should we disclose? The Supreme Court has given us some guidelines in Samira Kohli versus Dr. Prabha Manchanda, where they have stated that common risks must be told. Remote risks need not be explained, which may frighten or confuse the patient. The third aspect of a patient-centric consent is dialogue or counseling. After the patient gets information, especially about risks, the patients must have an opportunity to ask questions, and the patients must be given enough time to make a decision for planned cases. At this point, the patient and the doctor must come to an agreement. There must be no coercion, undue influence, or misrepresentation during this agreement. This patient engagement and empowerment is now called shared decision making. The fifth is the documentation and authentication of this process of consent. This formality is necessary because it is an evidence that we have counseled and then taken consent of our patients. Since our consent form is looking more and more like a contract, counter signature of the doctor is now become necessary along with the patient's signature. For high risk cases, it is advisable to take an independent witness signature on our consent forms. Our consent form must be in the patient's language, or an interpreter must be used. The form must have enough blank spaces for the name of the patient, name of the procedure, and the risks that were discussed. The name of the doctors treating must also feature in the consent form. As we said, these are the requirements in non-emergency cases. In an emergency, no consent is required. Wide discretionary powers are given to doctors to operate in good faith to save life and limb. In Pandit Parmanand Katara versus Union of India, the Supreme Court has clearly stated that human life is more important than legal formalities. Let us see what the consequences are if we don't take a consent. We would be criminally liable for criminal force or assault under the Indian Penal Code, for which the punishment is imprisonment up to 3 months and a fine of 500 rupees. Under the law of torts, trespass to a person is assault or battery. It is liable for compensation. Under the Consumer Protection Act, in last month, the West Bengal State Commission has held a cardiologist guilty of a botched informed consent. In this form, the patient's signature, the date, and the time have been left blank. No risks have been stated in the consent form, and the doctor's signature was found to be absent. A 3 lakh compensation and 25,000 towards costs has been awarded to the relatives of the deceased. As if this is not important, we may face disciplinary action by the state medical councils for misconduct. In 1914, in the case of Ramacharan Thiagarajan Fax versus Medical Council of India, the state council has struck the name of a transplant surgeon off the register for not taking an appropriate consent for the entire procedure of kidney and pancreas transplant surgery. We all understand the importance of taking a proper consent, but there are many logistic difficulties in taking this patient-centric consent. First is that we have no time in our busy practice for explanation and counseling. This excuse has been viewed negatively by our Indian courts, and they call doctors callous and insensitive. Doctors do not encourage explanation of risk, as it may make the patient anxious and he may refuse treatment. We all need communication skills to be able to communicate risks and yet give confidence for the patient to undergo the treatment. We greatly lack Indian data on mortality and morbidity, which can be disclosed to the patient. I would just like to state a few cases which are relevant for consent. In Janab Fazal versus Dr. Hamza Thail, the Kerala Supreme Court has held that oral consent in an emergency is valid. In M. Arunachala Vadivel versus Dr. N. Gopalakrishnan, an implied consent has been accepted. Written consent is a statutory requirement for procedures under the MTP Act, the PCP-NDT Act, the Transplantation of Human Organs Act, and also for clinical trials. Consent must be procedure specific and there should be no blanket consent. In Chinayan versus Sri Gokulam Hospital in 2006, a separate consent for blood transfusion is required. The name of the doctors need to be mentioned on the consent that is stated in Leelamma Joseph versus GG Hospital in 2013 by the Kerala State Commission. Telecasting a procedure live for delegates of a workshop without the patient's specific consent is not acceptable. Then no consent is required for relatives for a post-mortem for medico-legal purposes. And as of today, consent of relatives is yet required for organ donation after death. Let me conclude by saying that consent is not just a shield for litigation. A properly administered consent creates a rapport with our patients, improves patient satisfaction, gains trust, builds relationship, empowers our patients to share our risks and responsibilities. They understand the limitations of our treatment and have realistic expectations. And I'm sure this will go a long way to improve respect and recognition for our doctors. I would like to take the first question, which is from Dr. Rahul Kanaka. Which is the best form of consent in court of law? Audio, video, handwritten by the patient and signed by the patient and attendant. All three of these are admissible in court as long as the patient understands the risks of any of these consent are acceptable. Dr. Reshma Padmaran, regarding the informed written consent of patients for surgeries and procedures, is the printed version or a photocopy as valid as the handwritten one? Yes, we are only needing handwritten one because we want to protect ourselves even better, but printed version is acceptable. Dr. Guru Sharan Singh has asked, should we take a patient's consent in the native language in spite of the general hospital consent? It is really required that the local native language, all consents should have both English and the local language consents available. What about consent for HIV? Dr. Saurav Maiti has asked, what about consent for HIV testing in unconscious, mentally impaired and neurologically unfit patients? We have to rely on the patient's relative consent because the patient is unconscious. As far as confidentiality of the report being positive or negative, we can wait for the patient to be competent, but otherwise in a day or two, we would have to reveal this confidential information to the relatives. Do we need attendance consent for electrocosmetic plastic surgery under any kind of anesthesia? We just need the patient's signature. We do not need the relative's signature if the patient is competent, that is more than 18 years. We can take the witness signature, but we do not need the relative's signature. What is a valid age for consent? As I have already said, in the Indian Penal Code, in section 90, the age of consent has been stated to be 12. Here, the patient can consent for any procedure which is beneficial to him. And in the best interest, if no parents are available, we can take the patient's assent and continue to give in the best interest of the child. Necessary to take consent for removing porn under local anesthesia. Yes, there is some risk of infection. So it is better to disclose this risk and take a consent. Though implied consent is also acceptable, the fact that a conscious person comes to the operating table, does not resist your local anesthesia, would be defensible as an implied consent. Dr. Kina Shah, are there any specifications for thumb impression for illiterate patients? Yes, it is said that the right thumb impression for women and left thumb impression for male patients. Dr. Farida Noor, how to proceed for examination if an unaccompanied, unconscious, under influence of alcohol or minor is brought to casualty? We continue to give patient the required treatment as he is incompetent, and if there are any relatives with him, we will have to take consent of the relatives. Dr. S. Siddhappa, what are the ramifications of a consent in a hospital setting where organ transplants are being done? If it is a live donor, we need to take consent from the live donor. If it is a cadaver, even if the patient has given or pledged that he could be a donor, we yet require the consent of the relatives for a patient who is brain dead before we harvest any organs. Dr. Maria Franis Bukelo, what does the state law what on formalin fixed paraffin embedded tissue, which has been archived by the Department of Pathology? If they are tissues which have been taken long before and there is no access to the patient, then I think there is no need to go and find them. But recent tissue which is archived and you can find the patient's patient, it is a necessity by ICMR that all research done on any tissue of the patient consent is required. Dr. Sadhna Kulkarni, what is the age of assent in India to consent for foreigners who do not understand English or any Indian language? I think keeping it at 18 is safe for foreigners. Dr. Sarita Sharma, should we explain the complications of epidural to a mother coming for painless labor? It is extremely difficult for us to explain complications when the patient is under severe pain. It is important to make this information of epidural and its complications available to all antenatal patients at the 7th or 8th month, or by taking some prenatal class for these patients, so that they already have some information about these complications. Dr. Jayashree Joshi, how important is it to give the range of false positives and false negatives of a diagnostic test like pap smear to a woman before collecting a sample? Actually, having information leaflets available about all diagnostic tests is, I think, now a requirement, and that would definitely mention false positives and false negatives. The more we inform, the safer we are. What should be done if the intraoperative situation demands some procedure that needs to be done beyond the original consent was taken? In Samira Kohli, they have given a clear directive that we should not go beyond what was consented for, but in an emergency, one can extend the procedure. If it is only to avoid a second anesthetic or a second surgery, then it is best that we bring the patient out, explain the procedure, and then do it on a second stage. But if emergency demands and if the patient's life is in danger, one can do whatever is required. Dr. V.M. Ganeshan, if a patient or relative gave a consent prior to treatment and later denies or mentions that the consent was not understood and he was forced to consent, what are the consequences? Well, the patients always have this stand that we did not understand, and that is why it is important for us to make this information available as simple as possible without any medical jargon. And I think it is important for us to have these leaflets available and patient information available in simple words for most common procedures. Dr. Jayashree Venkataram, what is the role of video recording? Does it help? Does it stand in court for both consent and during surgery? The video consent definitely is a good evidence of the fact that all risks were disclosed. During surgery, of course, the patient must understand that the consent is being video recorded. Also, the patient must understand that the surgery is going to be recorded. Dr. Rakesh Mundra, patient's relative used to take photographs of medical records in ward. Can we stop them from doing this? Well, medical records basically are of the hospital. Yes, we can stop them from taking photographs, but we should not make a big hue and cry about this. If our records are accurate, I think anybody should be allowed to take a photograph. We are coming to our last question. Dr. Yuvraj Gupta, how many witnesses we need to get consent and who should the witness be? It is stated that we need two witnesses, and they should be independent witnesses, but we need to see that we would be able to access these witnesses. So it is in fact said that we should have their contact numbers and their Aadhaar card. Thank you very much, everybody, for joining this webinar. If anybody has any questions which we have not been able to take because of time constraint, do post them and I will try to answer them and get back the answers to all of you. Thank you very much for joining this webinar.